must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show. Hey everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Brandon Poland, and today I'm excited to welcome Dr. Joshua Bailey, who is the current president of the Virginia Physical Therapy Association, along with being the president and CEO of Rehab Associates of Central Virginia. Now, he also serves as an adjunct faculty member for numerous programs and teaches nationally on the evaluation and treatment of the foot and ankle. Now, Josh, I understand that there's probably way more to your background and your biography that I had just mentioned in those brief few sentences there. Would you mind sharing your story of kind of what's led you to where you're at today, along with how you got involved with VPTA to where you are now as the president?
Sure. Well, first and foremost, I'm a clinician. I've come from a clinical background. I went through what, most people today would call a fellowship. Back then it was called a residency because it was in the late 90s, and very specific to foot and ankle. And for the last 21 years, that's all I've really ever done as lower extremity biomechanical issues. And through that process, I much like a lot of people early in my career, I was just very focused on the clinical side of things. I was always a member of the APTA and the VPTA, but was kind of a passive member. And through that progression, and as our business, Rehab Associates, has grown, I saw gaps in clinical care. I saw huge variability in clinical care. I saw cost concerns, and I just started thinking, what are the ways that I could impact that? And so it really turned out to be twofold. One is I created a business along with a business partner called PT Management Group of Virginia, which is like a medical services organization that we offer clinical supplies and medical supplies as the primary tool. But the key there is getting to quality EMR systems and quality outcome tools so people can actually measure their outcomes in a clinically meaningful way to help them understand total episodic cost of care. So that was one avenue. The other avenue was, I thought that my personal opinion was maybe the VPTA could do a better job than what it was doing. And I'm not saying that the people that were in charge at that time were not doing the best they could with what they had to work with. I think everybody who's led that organization has worked very hard. But I saw, and maybe I thought I had some additional business skills that could help the organization. So I was the chair of the private practice special interest group for a while. And then the previous president asked me if I would run for the presidency. Not something I was ever really interested in doing. But he told me some of the issues that he saw facing the organization. And he said, I think you have the skill set to help us grow and to become a better organization. So begrudgingly, I ran thinking certainly I wouldn't win. And maybe in some ways, unfortunately, I won very handily. And now in my second term, and I hope I've made some positive impacts along the way.
Interestingly enough, I'm sure being the president, I'm sure there's a lot of things that are involved with that. So to give a little bit of context or some perspective, what do you specifically have to do as the president of the VPTA, and kind of what are some of the pros and cons of being in this role that you've noticed?
Sure. I mean, the number one role that we have is to bring value to our members. And, it's having a very open door policy, listening to members, determining where some people are successful or other people are struggling. How can we close the gaps there? Certainly, state specific payment related issues, are something that's always on our radar. And then, really the big thing is being a component of the APTA. And I view my job as being a conduit of sorts from what the APTA is doing on a daily basis and bringing it to Virginia so that our members understand what's out there, what the needs are, where we could step up to help. I promise you the APTA is involved at a significantly higher level than 99% of people are aware. And I generally knew what the APTA did, but now as I'm several layers deep and I have a board liaison to the APTA that I can reach out to, the amount of time and effort that these people put in for little to no gratitude, much less reimbursement, is amazing. And they truly care about PT as a profession, about the needs of our patients. None of those things ever lose the forefront in any meeting I've ever been in. And that's refreshing to see. And I suspect most people don't see that side. So you ask about pros and cons. A big pro is really understanding the larger picture. And having enough knowledge to be able to give people some additional insight on that. That's a huge pro. A con is, for me, some people want me to fix it, and they just want me to step in and fix it. And they'll say to me, I don't know why I'm a member. You should have negotiated that on my behalf. There's certain things that a professional organization just can't do. I can't negotiate contracts legally. And some members think that I should, or that the association should. So I think, having those difficult conversations of like, I'd love to help you with this, but I can't. But I can guide you with some key information to help you, get into the right places. But, there's some laws that prevent me from doing those types of things. And then that's uncomfortable. Nobody wants to say I can't, or I wish I could. So that's definitely a negative thing for me.
It's interesting to just gather that, being in this role, you've just had a tremendous insight into just how the profession works, how the professional organization works, but also realizing that, as you said, there are some limitations in being that, there are limitations that the association can do. And that's just kind of the way it is. But, I'm curious, Josh, just because hearing all the things that you're doing between managing a business, being the president, teaching, with all that you do, how do you balance all these things and how do you do it and stay sane?
Well, that is my sanity. My personality is not one where you want me to have idle hands. I'm going to make work for people. I grew up in a farming community. I'm used to working hard, and I do better when I have a lot on my plate. So my wife gets so upset with me when I say, once I'm done this, I'm not going to do anything else. I recently just finished a book chapter for an orthopedic specialist book. And I said, I'm never going to do another book chapter. I just didn't like it. And she was like, right. And I just find myself, I like to push myself, and I like to help other people. And so I balance it by staying busy, never having idle time. And, my kids, thankfully, are very tough. And I travel a lot with teaching and those types of things. So I'm gone a good bit of the time. So I got really good at FaceTime, tucking my boys in with FaceTime at night. And I understand that's not for everybody. And that's not because of the VPTA. That's just one of the components of what I do. But I think, I balance it the same way you balance it. I try to exercise every day. I go to work every day, and I try to stay laser focused on what the goals are. and try to have some wins.
Obviously knowing that, VPTA is kind of also represented partially, of course, by APTA. So how does VPTA collaborate with all the districts and special interest groups within the VPTA? Because I know there's a lot. To kind of just get some insight on how that network kind of works, just to gain some context, because obviously there's a lot of moving parts with this.
Sure. Well, one of the key things that I did early on in my presidency was to work very closely with our board to create board liaisons to each special interest group. And our board is made up of 2 members from each district. So in most state organizations are that way. So their board is elected, 2 positions from each district makes up the board itself. And the key is to make sure there's information that's flowing in both directions, right? It cannot be unilateral. The thought process tends to be that it needs to be from the APTA down to the state, down to the districts. And it really doesn't work like that at all. It needs to be bidirectional for sure. Information from a district saying, hey, we're having issues with this, comes to the state takes it to the APTA, and that's how APTA gets their information. So my job was to create really strong conduit to make sure that could work. And I spent a lot of time getting the right committee members and the right chairs into positions, finding people's strengths. I'm a huge believer in, try not to fix weaknesses, try to exercise strengths. And we have very, very talented clinicians in all different areas. For example, things like what you're doing with communication. We need people on the VPTA that enjoy communicating and passing along information and educating people. And we put those people in positions that they can utilize that strength to educate members. I'm terrible at social media. So I need, I'm like a stalker only. I scroll through, see what people say, and then I move on. I need people to pass that information on to our members through social media patterns that are out there that have that interest and skill set to do it. So we just have to find those people. We're always looking for someone who has a desire that they can build upon. And many times it's taken them to much, much bigger things. That's the hope, is that everyone grows from it.
Yeah, no, and I think that's really good. I mean, especially gathering that, information flow is a two-way street rather than just unidirectional. I think that's critical. And I know you had kind of mentioned that there is liaison, of course, to the APTA when the state association wants to kind of bring up issues to the APTA. But how also does it work regards to, so say for example, there is a problem that's worked up from one of the districts, worked up to VPTA, and then VPTA has gone through and relayed that to APTA. How does the process from which receiving information on these issues work? And how does this also have a relationship kind of within House of Delegates? Because I know some people aren't maybe aware of the House of Delegates and kind of that role that it plays in the grand scheme of things.
Sure. So, the APTA's got a lot of specific specialists. They have payment-related specialists. They have governance-related specialists. So my role is to determine what's the right bucket that this information should fit in. If a district brings an issue to our board and we decide as a board level that this needs to go to the APTA, then I usually work to align with the right vein. Is it advocacy? Is it compliance? Is it ethics? What's the right area? Most commonly, it's payment. I know the APTA payment and policies specialist very, very well. I have cell phone numbers and email addresses that we share information, and they've rallied around to help us. We haven't had issues from the VPTA where the president would address the House of Delegates. But each state has their own chief delegate that's elected, and the chief delegate is who would monitor the state for issues that they want to bring to the House. And for those that don't understand the House of Delegates, it's over 400 represented members from across the country that come together as the major rule-making body for the APTA. And it's very formal, parliamentary procedure, but it's year-round governance now. It used to be just 3 days, everything was decided. Now it's year-round governance. We talk about those things. We get a lot of information out there. The president is part of that, but the chief delegate is the leader from each state on that.
Yeah, and I think that's really important because, frankly, I mean, I didn't really understand a lot about what the House of Delegates was until I went to Next, and then I got to see it live and in person. Because, like you, early on, I kind of was definitely more of an outsider. Like, I knew a little bit about the APTA, but I didn't know the specifics of it. But, interestingly enough, doing this podcast and meeting different people within that and just learning all the work that's being done, it's really opened my eyes and said, wow, there's a lot of things working together to really address some of these issues. And I like how you kind of bring up that, obviously you've been talking with, especially when it comes to VPTA, talking within the APTA liaisons regarding payment. So of course, I'm assuming that that's one of the biggest issues that VPTA is working on now, but specifically regarding payment, what are some of the big issues related to payment that VPTA is working on now? And perhaps if there are any other big issues that perhaps are non-payment related that VPTA has been noticing lately that are kind of being worked on?
Well, the biggest thing from a payment related perspective right now is MIPS, merit incentive payment system. That is huge. It's the single biggest payment change that most of us are going to see in our lifetime. It's a major business decision. And so APTA has done a really good job of making sure that resources are available to members. So the VPTA's job really is to accentuate that and make sure that those things are not getting missed, because certainly the VPTA can't assimilate that level of information. We are all a volunteer staff. We have one paid staff member of the VPTA. And of course the APTA is significantly stronger, and they're meeting specifically with CMS to get questions answered. And, there's lots and lots of opinions that are out there of what should or shouldn't happen. With the Medicare physician fee schedule, APTA has done a great job of educating the public on that. And that's had a lot of criticism. The fee schedule cuts that are pending in 2021 for PTAs, and, they're like the APTA should have done this or the APTA should have done that. In all honesty, the people that are saying that have been disconnected because that was not even an option on the table. And, and APTA is taking a bad rap on that. And frankly, I think it's an awful decision that CMS has made regarding the fee schedule cuts, but it's the game that we have to play now. It's the law, and Congress passed it. Our job is to understand it and figure out how to best utilize it. And I think the APTA has done a really good job of helping us with that.
Yeah, and you had mentioned this big change regarding MIPS, and that's huge. And I realize that, some of our listeners are not perhaps APTA members and perhaps may not be super aware of this. Would you mind, Josh, just kind of giving a brief kind of overview of what MIPS specifically is and kind of how it's going to be carried out?
Sure. It's, this MIPS is what physicians have been doing for a while. So it's part of MACRA, which is, a Medicare reform to outcomes-based payment. And so for 2019, it has a ability to achieve up to a 4% payment increase over the fee schedule for outpatient services, or you can lose 4% of the fee schedule. And you're completely at risk by making sure that you created quality metrics, process metrics, and there are also interoperability and cost metrics that PTs are not yet participating with. If this is news to you and you're in the outpatient world, you need to find some resources, because this is the single biggest change that you'll ever face, because it follows you. It's not just the job that you're working in, it's by your NPI number. So when you leave one company and go to another company, your MIPS score will translate with you. That means you could be hireable or not hireable on your ability to provide quality outcomes. And, we've asked for outcome for years. This isn't the end all be all, but it's better than functional limitation reporting for sure, which thankfully goes away in another month. It's gone forever. Yeah, hallelujah.
Wow. Yeah. I mean, I'm like you. I mean, I think that's definitely a good step in the right direction. And, realizing, of course, like you had said, that there's limits of the organization and it's a lot of it's volunteer from the VPTA with the exception of one paid member. But what are some of the other barriers that VPTA as an organization encounters while kind of doing the mission that it's trying to do?
Membership is the number one. 30% of PTs in the state of Virginia are VPTA members, and we complain as a business, as a group of profession, that we get too much regulation compression on therapists, and we had it coming. With 30% involvement. And when we get down to the PTA level, it's more like 8% or 10% involvement. And, that's challenging when we have issues that we know are problematic for all PTs, but we just don't have enough support. Direct access in Virginia, we would love to have unfettered direct access. That's been a goal of the VPTA. We don't have enough money. That money is from political action only, and we have very low advocacy across the state. And I would love for you to help me get members to reach out, or get your listeners to reach out and say, hey, how can I help? And if everyone in Virginia, every PT in Virginia gave $2, we would be. If every PT and PTA gave $2, we would have the largest political action fund in the state. $2. That's not hard. and I assure you that is better than the regulation that can be applied upon us. And the only way we can get there is for people to be active. And you don't need to be active by being the president of the state or being a board member. You can be active by just supporting your profession. And direct access is a professional issue. It's not an outpatient or an inpatient or skilled nursing issue. It's about being a PT or a PTA.
Yeah. And, I kind of want to dive into that just a little bit more, Josh, because obviously, you're saying that 30% of PTs are supporting the state chapter in Virginia, but of course it's even lower for PTAs. I'm curious from your standpoint, why do you think that number is so low? Like, what are some of the reasons or contributing factors in regards to why that is the way it is?
I can only surmise. I've asked that question a bunch of times and I get a bunch of different answers. And the biggest obstacle that people say is it costs too much. And my answer I have a question to that is compared to what? VPTA, APTA membership is very inexpensive as compared to this Medicare physician fee schedule cut that just came through by and large, because that changes how PTAs will function forever, because it's now law. And the operational definitions that CMS has created for PTA involvement is less than or equal to 10% of the patient's care to avoid a fee schedule cut, which means salary cuts, which will be much more expensive than an APTA or VPTA membership. So that's the number one obstacle. The number two obstacle was, for a number of years, PTAs only had a half a vote. Each body had a half a vote in every state. And thankfully, the VPTA was on the front end of changing their bylaws to give a PTA a full vote. And we just knew when we did that, we were going to have this massive increase in PTA membership. And when it was about a 2% change. So we went from 6% to 8%. So we would love to have PTAs more involved. I think there's a need. I think there's a ton of value that can come from that. And frankly, it just broadens perspective.
Yeah. And because gathering, obviously talking with people on both sides of the fence, people that are within APTA, but also people that are not APTA members, something that I always kind of find interesting is, like you had said, the cost thing is brought up quite a bit, that reason. And my question always back is, well, how much does it cost to go to a CEU course?
Exactly.
About $500 to $600, give or take, for a weekend course. And that's pretty close to what it would be for a year of APTA plus your state chapter. It's going to vary. obviously,
Right.
depending on what you're in, but more or less you're kind of around that area. So it's like, my question is it more of a, they don't know what's being done and there's a lack of perceived value, and that's why they're not willing to fork up the cost? Like, that's just something I always kind of think about.
Sure. I mean, we ask that question all the time. The hardest part of asking the question is I don't have a good way to reach non-members. So I have email addresses for every member. I can send them a survey and say, what do you think is important? But to reach non-members, I don't have a good way to reach them. And, other than just people I know or people that know other people in the VPTA that are not members. And, and I ask them very candidly, like, why aren't you a member? And I just did a talk at a local PT school where, why should I be a member? And these were first year PT students and second year PT students. And so they were very keen on their anatomy. And so the last slide was an anatomical picture of vocal cords. And then the next slide was those vocal cords being severed. And it's like, this is what happens when you're not a member. Your singular voice to bodies that have people in position to communicate with those of power, why would you cut that off? And, and it was instilled in me in PT school. I just got my 25-year pin for 25 years of being in the VPTA. And so I've been there from the very beginning. And I can tell you, the more you get involved, the more you'll understand, the more you'll be behind what this, we're a great profession. We're the right answer in many, many chronic and acute conditions. People don't know it. And we have to do a better job of getting that message out.
Yeah, and I think that's interesting because, like you, I was kind of pushed initially towards being more involved in the APTA when I was in school. But I forgot what the research said, but didn't it say along the lines of within the first few years of people being a clinician, their membership tends to drop off? Is that accurate?
It is. And, our response to that is we created, two things. One is reduced membership for your first 4 years, as an early professional dues reduction, and 75% off your first year. To keep people from, if you're a member as a student, that helps people stay engaged. And so we've done that as an organization. And we also just recently created an early professional special interest group. We realized that some of the old codgers like me somehow were intimidating to younger members. And that was the message we were hearing. So we created a special interest group of very young professionals, and have a chairperson who he's 2 years out of PT school. And so he has resources to take information to his special interest group from the VPTA board or other members. And so that's just getting off the ground, and would love for people to get involved with that.
I love it. No, I love that, Josh. And, apart from obviously MIPS and a lot of other things, you had mentioned quite a few things earlier that, the VPTA has done. But what are some of the other bigger achievements that VPTA has done throughout its history that probably most PTs aren't aware of?
The biggest thing was, championing direct access. That's been massive. We first got the first version of direct access in 2008, and then we expanded direct access in 2015. Our goal in 2020 is unfettered direct access. And again, that's mainly from allowing PTs to function at the top of their license. It's one thing to be called a doctor. It's another thing to act like one. Mm-hmm. And, and we need this level of autonomy to be respected. And certainly in the value-based payment world, early PT has never been disproven. Right? It is such a valuable tool, but we can't do that. When right now only 10% of our members have direct access certification, and anybody with a DPT can get it. Mm-hmm. Yeah, so it's not a hard thing. It's just not being valued, and so I view that as a VPTA problem. We need to educate that. I think that's a huge thing. The PTA full vote was a major overhaul thought process. And now currently we're re-engineering the way the organization functions because education is so critically different. Education has been the primary financial driver of the organization, like continuing education courses. And really about 5 years ago, the pendulum just started shifting to online education, and people didn't want to pay for that. And subsequently, our annual conference went from 300 or 400 members attending to 50 or 60. And it was a major transition. So part of, my role has been, we need to figure out what people want and how they want it, and change to it. And so we've done that. And instead of losing money through educational endeavors, we're presenting the education people want. And this year at our Fall Summit, which is our annual meeting, the largest attendance was to our business meeting. We had over 100, right at 100 people attend our business meeting. And that was surprising to me. I didn't think anybody wanted to sit through a business meeting. I sit through enough of them, and we had people signing up that weren't even part of the conference. So that was very interesting to me, and I think it's something we have to pay attention to. That's what people are interested in learning about.
Yeah, no, that's interesting. I wouldn't have guessed. I wouldn't have guesstimated that either. Josh, I realize that you've said quite a few of these things maybe already, regards to strengths and limitations of VPTA. But apart from what you've already mentioned, if there's anything else that perhaps you hadn't mentioned, what are some other strengths and limitations of the VPTA from what you've kind of recognized?
The strengths in the people. We have some really talented people that a lot of people don't know because they're not necessarily engaged. But the leverage that's out there with the people, we are very, very blessed in Virginia. One of our committee members was she ran against Sharon Dunn as the APTA president. She's here in Virginia. The previous Speaker of the House at the House of Delegates is our chief delegate. So these are very influential people that have a ton of institutional knowledge that are present. And we have a ton of members that have been members for 20, 30, 40, 50 years. We just gave away a 50-year pin at our Fall Summit for a member who's been part of the organization in leadership roles for 50 years. They know a lot about this organization. And guess what? A lot of the issues that we face today have been faced in the past. People talk about, physician-owned practices and hospital systems that are narrow networked. That's not new. None of that is new. And members have been around and negotiated those things in the past and are great resources. So getting to know the people is probably the greatest strength overall. And the greatest weakness is apathy or engagement. No other healthcare group that's emerging has apathy. The Virginia Orthopedic Society, the Virginia Physician Society, the Virginia Hospital Society, there's no apathy there. The Virginia Chiropractic Association is very, very active. I think 75 to 80% of chiropractors are a member of that organization. We're doing something wrong. And if you guys have insight to what that is, please let me know. We would love to understand how to make that better. But that's our biggest negative, biggest obstacle that we face.
Yeah, I think that's interesting because, it's been surprising just seeing, how much, if we want to talk about just kind of political power, how much chiropractors have really been able to push. Not just from a state level, from a national level and what they've been able to do. The evidence may or may not favor one profession, but yet the politics of it can kind of overcome that. Sure.
And the voice, with the voice and numbers matter. If the number of members step up and say, hey, we want to work towards this goal or away from this goal, reaching out to Congress members and being politically active, that's not a hard thing. These are people that live and work in your communities. We try to organize those things as best we can. We can provide talking points. So you don't even need to be in the loop. You can read a little one-pager of, here's what we need to get across. And and people that have community relationships matter. And it doesn't, I hear people say, well, I work for a hospital. It doesn't impact me. It absolutely does. And those hospitals have CEOs that are well connected in the healthcare community, or board members that are well connected. Those things make a difference. And that's how chiropractors have been successful. And, they're very collegial. I work with the Virginia Chiropractic Association on certain issues, and they have been very open. There's no competitiveness. We do the same thing with the Athletic Trainer Association. We're all there to get patients better, and we want to do it in a way that's cost effective. And frankly, I'm trying to learn from them. Their association numbers are much higher than ours. What are you doing to make this successful? I want to do the same things.
Yeah, and I think that's a pretty important point and a behavior that you bring up, is that really just kind of learning and branching out to other organizations, other people that perhaps have a different view on things. Because honestly, the more I've reached out to other people that don't share what I have, the more I've learned.
Sure.
So,
yeah.
I mean,
I don't know what I don't know.
Yeah, it's true. No, it's true. So obviously gathering that, obviously the big thing is for people to get involved. How can people get involved with the VPTA, even if they have limited time to contribute on the level that they can? Like, where would be a good starting point for them to kind of go?
The first thing to do is just go to the APTA website and just sign up as a member. Like that. I mean, that takes 3 minutes. And while you're there, just fill out your member profile so you can be on Find a PT, so the general public can find you and use you as a resource. And you can attend a district meeting. That takes no work. It's passive, but you can learn and you can meet people. And, I don't know any successful business person that's isolated. And, so the more people that I get to meet, the happier I am, because I learn new things every time. So I think that's an easy introductory way. If you want to dip your toe in just to a committee, if you're a member, you have to be a member to be on a committee, but, we can give you very low intensive jobs, something that you touch, 5 minutes or less a month. It's not hard. And then, those people tend to find strengths that they really enjoy, and they ask for bigger opportunities. And, we don't do a lot of pushing. We try to do a lot of pulling, and helping people get to where they want to be and things that they find successful, and meaningful. And I think that's the biggest thing, that if you talk to someone who's been engaged, the biggest thing they're going to say is, the meaningfulness that I get from working with other PTs and learning from other PTs is the most valuable part.
Yeah, and then that certainly seems to make sense. And for everyone who's kind of just curious, go ahead and check out the show notes, because what I've attached in there is going to have kind of a link to all the things that Josh has kind of mentioned. So if you guys want to check that out, please do. And Josh, it's been really good to kind of get your perspective on from the level of the state association and kind of learning more about that work, how that works, and some of the issues that you guys have been working on. But the question that we ask to everyone is a kind of a different question. So with us being called the Healthcare Education Transformation Podcast, of course, we got to talk about education somewhere. So the big question that we ask is, if you could change one aspect of healthcare education, whether it be PT or otherwise, which aspect would you change, and how would you change it?
Well, let me start with the end and back my way into it. I think the biggest thing we have to combat right now is the cost of education. The cost of education is high, and I understand why it's high. But we're going to start, if we've not already, losing some of the talent that should be in our field to other professions. And I've seen people, challenging, should we have ever converted to a DPT? And, that's gone, and that horse is out of the barn. We need to figure out ways to disrupt education to the point that we can control the cost. And whether that be some type of hybrid model, whether that be, and I'm a big proponent of a much larger clinical-based education. I'm not personally a fan of 6 and 8 week rotations. I'd rather see 6 and 9 month rotations so that I can actually work as a mentor to a young budding professional and teach them what it's like to do business every day and care for the entire episode of the patient, manage the physician relationship, manage the patient, manage the patient's family, manage how patients view physical therapy, beating that physical therapy is a commodity. We are not a commodity. No one's ever said, I had dentist and it didn't work, but they said I had PT and it didn't work. We've allowed that. We have to disrupt that through a clinical education model that has people passionate about what they do and, ultimately skilled. And I get that that's an entire shift in the educational model. It's been a topic of House of Delegates as well. But I feel like that's the number one change, that if we have to change the price point first and then change the overall modeling of the clinical education process.
One thing that's been interesting, and I don't know logistics wise exactly how this would work, but someone actually brought up the idea of having a DPT program that's not associated with the university, because then the program could charge their tuition that's not delegated by the Board of Regents. Now, I'm not saying that should or that shouldn't happen, but I'm just saying I think it's worth investigating because obviously, with costs going up, I talked to a pre-PT the other day, and she definitely didn't seem to be aware of the financial market implications regarding everything. And my goal is not to discourage people, but my goal is to be real with them and tell them these are the cards that are dealt. If you love it and you know what you're getting into, then I want you to full go for it, and that's great. But if you don't know what you're getting into, or if you're like, maybe that's not for me, then, ultimately, I don't want to push people away, but I think we need to have the honest discussion about this is what it costs. This is what on average you can make. And again, it's not isolated. Like, there's opportunity. Like, you can go above and beyond that if you're willing to do these other things. So, and that's just the hard truth. And, I think that other model should be at least looked at.
I couldn't agree more. And I think it requires, we can't look backwards. We can't look at our current program and say, what can we change it to? I kind of equate this to when the rest of the world was trying to figure out how to get a discman not to skip. Remember the disc players that you used to try to run with and it would skip the whole time? Yeah. The rest of the world was trying to fix that. And Steve Jobs said, you don't use a disc, right? We're going to have an iPod. And I'll never forget the interview that he had with Time Magazine. They said, well, how much market research went into this? And he said, none. Why would I ask people something they haven't thought about? And, and that's where I believe education is. We can't say, how can we change this curriculum to match the needs? We have to say, this is what the needs are. Now let's build a curriculum that educates people proficiently for physical therapy and aligns their clinical education models to that of the rest of healthcare. We can't be different from physicians if we want to be called doctors and ever be successful long-term as far as being a primary care player in musculoskeletal management or otherwise.
Yeah. And and it's huge right now because I know that programs have CAPT and the board exam as things that they have to adhere to. And I know that definitely throws another wrench in the mix.
It does. And I'm not claiming to, understand all the facets of that. I've certainly met with CAPT before on behalf of various institutions and, and they asked me some very unusual questions, that I wasn't expecting them to ask. In some ways my belief is maybe at times the emphasis is on the wrong syllable. And this coming from a straight clinician, right? I know nothing about building a curriculum for a school, but when I look at the totality of the profession and where the biggest obstacles are, that's something that we have to approach, and we're going to have to approach that with disruption, not management. In every major shift we've ever seen, for Bitcoin, for example, no one really saw that coming. And it just had to be a disruption to be a thing. And I think education is not that far behind that.
Yeah. I mean, it's a huge issue. I mean, there's so many things moving into it, but I really like that interesting point, those points that you bring up, because obviously there's a lot of people that are working on these different avenues of it. Josh, where can people find more about VPTA or reach out should they have a question or just kind of want to learn more about being involved with the association or just kind of finding out more?
Sure. If you, the best place is to find us online at www.vpta.org. And you can certainly email us at vpta@apta.org. And so that goes into a general mailbox, but our executive director will filter that to the most appropriate person. If it's a payment concern, we have a payment and practice chair. If it's a governance concern, we have ethics people to help look at those things. Or if it's just a general question about the organization, she's going to route that to me. And, the difference is you're going to have a person answering you. Mm-hmm. You're not going to get a canned answer. We're people doing the same job that you're doing every day. And, when we want to see it be the best it can be. So please reach out, ask questions, figure out how you fit, whether that be in a big role or small role, it doesn't really matter. The key is to have a role.
Yeah, no, I think that's a really, really good point. And Josh, thank you so much for your time, because I know it's been very valuable. I know you've got a lot of stuff going on, but thank you for taking the time to share some insight into this, because I think this will definitely reach a lot of people to get that message going. So thank you for all your efforts and all that you do.
It's my pleasure. Thank you for having me.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available on our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.